Hello, today we will discuss the ethical dilemma surrounding mental health treatment. Our group includes Shaina Dolgowicz, Bryana Lanier, Lindsey Rencoukos, and Kaitlyn Shorty. Mental and behavioral health have largely been ignored aspects of medicine until the late 1990s. With the revolution in mental and behavioral health management, specific ethical issues remain up for debate.
Going to be going over the legal precedents and aspects of mental health treatment and some of the ethical challenges of that. I have some landmark legal cases in mental health treatment that I want to highlight. One is Estelle versus Gamble, which established that prisoners are entitled to a minimum level of mental health treatment, highlighting the obligation of the correctional system to provide adequate medical treatment of patients who are exhibiting mental health issues or issues. Yes. We have Renee versus Klein of 1978 and Washington versus Harper in 1990, which addresses the right of involuntary committed patients and prisoners to refuse treatment, underscoring the importance of consent and autonomy in mental health treatment. We have Jackson versus Indiana of 1972 and Addington versus Texas in 1979, which focused on the due process and the commitment process, ensuring that commitment is justifiable and for the purpose of providing appropriate treatment. O'Connor versus Donaldson of 1975 and Heller versus Doe in 1993, which highlighted the criteria for confinement, such as the necessity of being a danger to others or incapable of surviving safely without care, and addresses the classification of mentally retarded individuals. We also have Selling versus Young of 2000, which upheld the civil commitment of sexually violated perpetrators, reflecting the balance between individual rights and public safety concerns. We have I'm going to go over some recent legislation. I'm going to be going over some legal cases and precedents involving ethical challenges in mental health treatment. We have some landmark cases in mental health treatment. We have Estelle versus Gamble of 1976, which established that prisoners are entitled to a minimal level of mental health treatment, highlighting the obligation of correctional system to provide adequate medical care. We have Renee versus Klein of 1978 and Washington versus Harper in 1990. This addresses the right of involuntary commitment and committed patients and prisoners to refuse treatment, underscoring the importance of consent and autonomy in mental health treatment. We have Jackson versus Indiana of 1972 and Addington versus Texas in 1979, which focused on due process in the commitment process, ensuring that the commitment of justifiable and for purpose, providing adequate appropriate treatment. Focus on due process in the commitment process, ensuring that commitment and justifiable. Commitment is justifiable and for the purpose of providing appropriate treatment. I'm gonna try this again. One more time for the good time. Good evening or good morning, whenever you guys are going to be seeing this presentation. I'm going to go over recent legislation. Lower Healthcare Cost Act is a comprehensive act aimed to overall healthcare reform, including aspects related to mental health, seeking to make healthcare more accessible and affordable. We have RISE, Resilience Investment Support and Expansion from Trauma Act, which focuses on trauma prevention and resilience building, acknowledging the impact of trauma on mental health and the need for comprehensive support systems. We also have Mental Health Services for Students Act, which addresses the need for early identification and intervention for students at risk of mental health issues, emphasizing the importance of mental health services and educational systems.
To discuss a little bit more about ethical challenges involving involuntary treatment, patient autonomy, and social stigma, is involuntary treatment could be in a correlation with patient autonomy. Involuntary treatment is a treatment towards a patient against their will. So usually this is seen as an unwanted exception to standard of care, and it could cause harm to therapeutic alliance, and with that it could also cause harm to the patient as well, depending on if they're able or if they're capable of making autonomy decision. So involuntary care or treatment could be seen as, for example, for a patient who is incapable of making their own decisions. Usually they see this in patients who are malnourished and they have a mental disorder or illness that keeps them from eating. And so they would go through a process where they would have to do an intervention of an NG tube to make sure that this person is able to get, food, nourishments in their body. So with that, sometimes they would have to have a communication and discussion with case management, with the psychiatric doctors, and as well as with the patient to try and get them to understand, to educate. Even if they're denying the NG tube, you also got to make sure that the patient is still incapable of making that decision. Sometimes they would leave it for like a few days, and if the patient has not eaten anything within the few days, then they would go through the intervention process of involuntary treatment. An argument against involuntary treatment is like justified cases. Sometimes in some cases, there are people that are able to make the decision on their own, but then they consider them still incompetent due to either maybe social stigma. And social stigma is the disapproval or discrimination in an individual group or a person itself. So involuntary treatment, I would consider this to be as a more of a, like a, how would I explain it? Like a like a good way of making sure a patient is able to get the treatment that they need, especially when it comes to mental health, especially a homeless person, especially with someone who has a severe mental disorder like schizophrenia, or they're having issues with body image. So involuntary treatment could be capable in those type of aspects where people aren't able to make their own decisions. And sometimes social stigma can also be the factor and could be a discrimination towards involuntary treatment. But to go into social stigma, especially involving in mental health, is usually when someone with a mental illness, they're either called dangerous or crazy or incompetent rather than unwell. They usually treat these people in a different manner. They discriminate them, especially if they have a mental disorder on a job. If they're interviewing for a job, the hiring person could not hire them due to their mental illness. Usually these type of people are either mocked or called weak for seeking help. And this could be a great interference when it comes to healthcare and treatment. And it could be a challenge as well when it comes to treating mental health patients. And with that, usually sometimes you can get any inaccurate stereotypes, as well as there are different stages when it comes to different types of mental disorders and anxiety and depression. You have some severe anxiety, severe depression, you have PTSD, you have schizophrenia, just a lot of disorders that people can make wrong judgments about them. And when it comes to social stigma, there are articles that are trying to find ways to end this, that there, to this day, that there are people and companies and even healthcare facilities and even counseling places that still hold social stigma, I wouldn't say standards, but still hold the platform when it comes to treating mental health patients. But in an article, they're finding ways to try and end social stigma, not just within the US, but throughout the entire world. And with that, they look at self-stigma, which is when people with mental health conditions are aware of the negative stereotypes of others and agree with them and turn them against themselves. Another one is stigma by association, refers to the attribution of negative stereotypes and discrimination directed against family members or to mental staff. Public and interpersonal stigma, which refers to the forms of knowledge and stereotypes towards like being prejudice and discrimination by members of society towards people with mental health conditions. Structural stigma refers to policies and practices that work to disadvantage of the stigma group. So these 4 types of stigma is what they're trying to characterize, not people, but to give an understanding of what type of stigma there are, and that could be seen within the daily process, whether in a healthcare facility, whether in school, whether at a job. So they are coming up with ways to try and end this. And with what I could find with healthcare, what they said is vocational training in healthcare. They want to make this a mandatory component and to help with the needs and the rights of people with mental health conditions and to give a co-delivery. And the reasons to give help or to end social stigma is to reduce a person from being able to avoid getting treatment. So when it comes to social stigma, it can be interfering with mental health care treatment. And usually sometimes, as I said before, that people may deem these people as weak and, they need help, or, they're deemed dangerous, or they're psychotic, or they're, sick in the mind. And usually when it comes to this interference with treatment, it could consider them as being labeled, and as well as separation, status loss, and it can cause a lot of discrimination. Especially like, for example, for a person who's, being diagnosed with schizophrenia, people can call them schizophrenic. You're schizophrenic. And that could actually hurt a person, and that could actually hurt their mental health, and it could make them feel not welcome and make them feel like they don't need help in a way. So with that, it's a big factor that is still being played in today's society. But there are articles that have gone against social stigma as well as involuntary treatment, where they find involuntary treatment not necessary. They've always kind of deemed it as a self-responsibility, saying that, it's their fault for getting them in their own position. If they're not going to comply, then why should we help? And that is a big disagreement that I have. We should try as possible to make sure that we give care to these people. Another, when it comes to social stigma, is they think that social stigma is part of like an ethnic minority type of mindset. They think it's a victim blaming, community blaming, religious, traditional blaming for the way these people turn out. And they kind of throw in race involved within it, when really mental health, all in all, is a worldwide issue, and it's not just a specific race or not just a specific community or religion that can affect a person. It could be any types of form of trauma that is brought upon the person, and that people that make these arguments, it's not right. In my opinion, it's not right. And I think there should be better ways to try and figure out how we can stop social stigma. And we should implement more involuntary treatment, especially when it comes to mental health patients.
How ethical issue impacts healthcare delivery and impacts PA practice of medicine. Within the realm of patient treatment, an array of medical ethical issues comes to forefront, ranging from waiting list dilemmas and access to resources to decisions on most appropriate course of treatment. It is imperative to note that ethical considerations extend beyond legality. Something can be ethically questionable while remaining within the bounds of the law. The ever-evolving medical landscape introduces new ethical quadrities, as evident in a recent Sermo survey, where physicians identified balancing patient care, quality, effectivity as a predominant concern. Responses to ethical dilemmas included allocated limited medications, addressing end-of-life issues, ensuring access to care, and maintaining doctor-patient confidentiality. Furthermore, the survey shed a light on other top ethical issues faced by physicians, encompassing the influence of insurance on medical care decisions, with insurance companies often causing delays or denials in surgeries. Patient privacy and confidentiality emerged as a paramount legal and ethical concern, with 15% of responders highlighting doctor-patient confidentiality as their top ethical issue in medical practice. Healthcare providers bear a profound obligation to safeguard and preserve the privacy and patient medical records, underscoring the enduring significance of ethical considerations involving the landscape of healthcare. Ethical issues play a pivotal role in shaping the landscape of healthcare delivery and significantly influence the practice of physician assistants in medicine. These issues encompass a broad spectrum, ranging from patient care decisions to the broader ethical considerations inherent in the healthcare system. One of the primary ethical issues impact healthcare delivery is through the decision-making process in patient care. Physicians and PAs grapple with dilemmas related to treatment options, resource allocation, and balancing the interests of patients and the broader community. For instance, issues like end-of-life care, allocation of scarce medical resources, and ensuring equitable access to healthcare services present complex ethical changes that directly influence the quality and inclusivity of healthcare delivery. Moreover, the ethical landscape significantly shapes the practice of PAs in medicine. Patient autonomy, informed consent, and maintaining confidentiality are foundational ethical principles that guide interactions between PAs and patients. Respecting the autonomy of patients while ensuring they are well informed about their medical conditions and treatment options is a continuous ethical consideration in daily practice. The responsibility to provide compassionate and culturally competent care adds another layer to the ethical framework within which PAs operate. Furthermore, issues in social justice and healthcare disparities impact both healthcare delivery and PA practice. The ethical imperative to address disparities in healthcare access and outcomes requires productive approach from PAs, pushing for policies and practices that promote equitable care for patients. In essence, the ethical considerations are woven into the fabric of healthcare delivery and the practice of medicine by PAs. Navigating these ethical changes requires a commitment to core principles, ongoing education, and a dedication to providing patient-centered care while advocating for a just, equitable healthcare system. We can now ask how ethical issue impacts the patient, since we have now seen how it impacts the physician and the physician assistant's practice. Ethical issues in healthcare have profound impact on patients, influencing various aspects of their medical care, decision-making processes, and overall well-being. Right now, I'm going to go through some ways in which ethical issues can significantly affect patients. The first one I would like to go over is informed decision-making. Ethical principles emphasize the importance of informed consent, allowing patients to make decisions about their medical care based on clear understanding of risk, benefit, and alternatives. While ethical guidelines are followed, patients can actively participate in decisions about their treatment, ensuring that their preferences and values are respected. The next I would like to go over is privacy and confidentiality. Patients trust healthcare providers to safeguard their sensitive medical information. Ethical breaches of privacy and confidentiality, such as unauthorized sharing of medical records, can erode this trust and create emotional distress for patients. Ensuring the confidentiality of patient information is crucial for the maintaining of a strong patient-provider relationship. The third one I would like to go over is access to healthcare. Ethical concerns relating to healthcare disparities and access to medical resource directly impact the patients. Inequitable distribution of healthcare services, whether due to social economic factors, geographic location, or other disparities, can result in certain patient populations facing barriers to essential care. This can lead to adverse health outcomes for those with limited access. The fourth I would like to go over is the quality of care. Ethical considerations play a vital role in maintaining and improving the quality of healthcare services. Issues such as competence, transparency, and professional integrity impact the standard care that patients receive. When healthcare professionals adhere to ethical standards, it contributes to better patient outcomes and satisfaction. The next we can go over is end-of-life decision-making. Patients facing serious illness or end-of-life situations encounter complex ethical dilemmas. Ensuring that patients are involved in decision-making processes regarding healthcare preferences, including decisions about life-sustaining treatments, that is essential. Respecting a patient's autonomy and honoring their wishes at the end of life is crucial to ethical responsibility. A good example of this is if the patient does not have has a do not resuscitate and the patient passes, but the patient's children are trying to push the doctor to ignore the DNR that the patient requested. that is a big end of life decision making that the patients do go through. And that is another ethical dilemma that the physician or PAs are put into when dealing with the family members. The next I would like to go over is cultural sensitivity and respect. Ethical healthcare practices underscore the importance of cultural competence and respect for diversity. Patients from different cultural backgrounds may have unique benefits, values, and preferences. Ethical healthcare providers strive to deliver care that is sensitive to the cultural differences, promoting a more inclusive and patient-centered approach. This can kind of be wrapped into dealing with the physician or PA or the patient having to really press their beliefs, it could be religion, onto their healthcare, and then just having a provider base their treatment on their beliefs. So that is a kind of ethical dilemma that is, again, both put on both the provider and the patient. The last one I would like to go over is financial considerations, because in this world, we always have to consider financial considerations when thinking about healthcare. The financial aspects of healthcare, including issues related to insurance coverage, billing practices, and the cost of medical treatments, can have ethical implications for patients. Ensuring fair and transparent final practices contributes to trust between patients and healthcare. In summary, ethical issues profoundly impact patients by influencing the quality of care they receive, their involvement in decision-making, and their overall experience within the healthcare system. Adhering to ethical principles is crucial for fostering a patient-centered and compassionate approach to the healthcare delivery.
Do you have any recommendations or best practices on how healthcare providers can resolve the ethical dilemma surrounding mental health? Changes that would help alleviate the ethical tensions surrounding mental health include increasing resources for patients who are unable to get non-emergent medical help, increasing inclusiveness while decreasing the social stigma surrounding mental health help, and creating patient education for all ages in relation to mental incapacity and the need to have a medical plan for those situations, even if there is no urgent need for it. There are already many options for medical care for non-emergent situations for patients who may not have health insurance or a way to pay for medical care. These services rarely cover or offer mental health services. Current resources for emergent situations surrounding mental health are available, for example, suicide helplines and court-ordered addiction rehabilitation. Creating opportunities outside of these emergency situations can prevent the population at risk from needing these services from getting to that point. Volunteer providers can offer a free or nearly free mental health clinic in their communities, even if they aren't mental health specialists. Often, just having the person available to vent to can help prevent mental health problems from getting worse. However, I recommend avoiding offering free medication through these services because of the high likelihood of the improper use or resale of those medications. Social stigmas surrounding mental health make reaching out for help difficult and embarrassing. Providing options to work around that stigma can lead to a change in mindset that allows our society to diverge from that stigma. An option for providing opportunities for mental health help without embarrassment or judgment include anonymous screenings for mental health status for those who are at high risk. An example of this is the screening used on postpartum mothers to check for postpartum depression. It is difficult for patients in that situation to admit they need help and may be a threat to themselves and those around them. So providing private screening without anyone present, including spouses or family members, can help that patient open up more about needing help. Creating open and honest rapport with patients is also crucial to assisting them in opening up about problems they may feel aren't worth discussing. Most importantly, educating the younger generations about the importance of seeking help with their mental burdens is what will change how our society feels and reacts to mental problems. The best way to deal with social stigma is to destigmatize the topic of mental health. Lastly, providing patient education about the importance of having advance directives and medical power of attorney, no matter the patient's age, will allow the blurred line between patient autonomy and incapacity to be overcome. Mental incapacity can happen at any time for any reason and is a significant topic in medical ethics. Patients can be deemed mentally incapacitated from many situations, some examples of which are a car accident, which causes a concussion, body image issues leading to mental health problems, and a variety of other reasons outside of the assumed old age dementia. Creating a plan while in a stable state of how a patient wishes to be treated, assuming they are incapacitated, will allow the patient peace of mind and allow providers to quickly and accurately treat the patient. Providing someone with knowledge of this plan and whom the patient trusts absolutely with a medical power of attorney will allow an advocate for the providers who may run into controversial circumstances that typically requires the patient's consent. Changes that make treatment of and living with mental health problems easier for patients and providers alike will help to eliminate some of the complications that mental health creates in our society. Providing widely available and mostly effective forms of mental health resources will allow those who can't receive help but want to improve their mental health with the resources they need to seek it. Stigma will go away provided that younger generations are appropriately educated about the importance of mental health, and alternative methods of screening allow for patients to be open and honest about their current issues. Lastly, educating patients from all walks of life and ages on the importance of advance directives and medical power of attorney will help the patient-provider relationship iron out the blurred lines between respecting patient autonomy and determining patient incapacity. Thank you for listening to our presentation on the ethical dilemmas of mental health treatment.